9% of the deaths in India are currently due to cancer.
Very important in any cancer patient is the support of the family. As a doctor, I may spend 30 minutes, an hour with them, but other 24 hours will be spent by the family. How much support they give, it will keep the person very happy. We have a patient of stage 4 cancer surviving 5-6 years or more without any side effects.
People knowing cancer being genetic, it's still a taboo in India, especially in rural areas. Why that fear of, in case something? What will happen to my child? Who will marry her? It's a taboo still. It needs a little time. More education through your medias and other.
If you are detected as a diabetes, can anybody cure it? You live with it. But at least in cancer, in stage 1 and stage 2 and stage 3, still you can cure it.
It is a catch-22 situation. Let's face the devil. Let's not evade the devil.
Dr. Rakshit, Dr. Suresh, thank you so much for joining us on this talk show. This is our 4th episode, and we've done a couple of episodes before on a few other topics, but this is a very interesting one. Rise of cancer in India particularly has been hitting the news, and I'm very glad that I have 2 experts on this episode to talk a bit more and discover a few things, understand what's behind the word cancer. The word cancer causes a lot of scare in the people, but I think today's episode we want to really break it down, understand what cancer is really about, how to mitigate, how to do more testing, how people can become a bit more comfortable, and to almost understand that around us people are living with this. So that's going to be more on the episode, and I'm going to introduce both of you. Dr. Rakshit, you're from Bangalore, an engineer to begin with. You did your MBA after that, and you moved to the medical field, complete turnaround. So there's an interesting story behind that for sure. You did your PhD in Genetics and Immunology, and then you are a postdoctorate in Oncology. You run this BMS group and own it, and then you run hospitals all across, and one of them is called Medicover, which you recently opened in Bangalore. And we have Dr. Suresh Babu, who is from Tumkur originally, and you're an MBBS MD from Bangalore KIMS, and you're a DM in Medical Oncology from Cancer Institute of Chennai, and a senior medical oncologist as your profession. And you've been obviously in Bangalore and have experience of more than 16 years, 200 national and international publications to your credit. So there's a lot of weightage on that. Do you want to add something more about yourself, Dr. Rakshit, and what you've been doing lately and what's been happening in your space?
Thank you so much for calling us, and it's lovely to be talking on the Citizen Talk Show. Like you said in the start that it is scary, but once you understand it, you need not be scared. All you have to do is have the right doctor, have the right treatment, and it can be treated. Now the technology is changing. The medical oncology, like Dr. Suresh, have been in the field and been working on patients. We have seen tremendous leaps and bounds change. It's no longer you need to worry. Yes, it is scary, but you need to be there for the patients.
Sure. I want to take one step back. Maybe this question directed to Dr. Suresh, because the word cancer is still, we all know it's something bad medically, but if you could break it down, I think to break down what is cancer, what is oncology also, because this is a term which people also want to discover.
I think to answer your question, Mayur, thank you first of all. So oncology is about the study of cancer disease, any type of cancer. Basically in oncology, in the treatment specialty, there are 3 broad branches. One is the medical oncology, which deals with the medical or drug aspect. Surgical oncology, which deals with the surgical aspects. The third division is the radiation oncology, which deals with the giving radiotherapy and also. This is the treatment. So other aspects like genetics and all are again much broader. Cancer by means or anything, basically in a body there will be a proliferation of cells which are not required for the body. Usually what happens is, in normally when a cell proliferates or multiplies, there will be check and balances for that. After some time when it becomes old, it will vanish on its own. So, but in cancer it doesn't happen that way. So those cells which are not required, they try to multiply. They will also snatch the blood and other nutrients from the other parts of the body. It's basically a proliferation, abnormal proliferation of the cells, which is not required for. That is the definition of the cancer.
Thank you. I think that's helpful to break it down. Anything else you want to add to that, Doctor?
So for common people,
Yes.
What is a cell and how it proliferates and other things, there is an hardware and a software in a cell. The software problem is what Dr. Suresh Babu is talking about.
Sure.
When there is a error in the software is when all these things start to go wrong. And like he said, there are 3 different branches. Each of those branches are independent, but they have to work in synchrony with like a symphony of music. Only then the patient can be treated very beautifully.
Sure.
So that is exactly what Suresh is trying to tell to the general public.
Sure. So I think there's some facts, right? So there's been a recent study, and data also says that India is going to expect about 15.7 lakh cancer patients by year 2025. Also, 1 in 9 Indians are likely to develop cancer in their lifetime. So it's like if you're a room full of 10 people, it's likely that 1 person or 2 people in that room are going to be affected by this. So the question is directed towards you, Dr. Rakshit, as someone who runs and owns multiple hospitals, labs, being in this space. How do you see the increasing number of cancer cases impacting the Indian healthcare system, particularly in terms of infrastructure and resources?
I don't know the statistics, the part of it, but more so what we have seen globally is every individual, whoever is walking around, will have cancerous cells. Need not worry about it. Your immune systems are capable of handling it. Only when Suresh said that something goes wrong is then you need to worry about. Yes, cancer is on a rise, and it is every family now predominantly would have heard either from their kith and kin or from their own relatives something to do with cancer. You need not be scared about it. You have to be cautious about it, and you should be well informed about it. So the rise is of multiple, maybe Suresh can add on to it, both genetically, which has been there, but also environment, which has been causing this sudden outburst of the thing. In olden days to present, why we are seeing this rise globally is also because more testing has been happening. People are more aware of it. Doctors are there to treat. The global phenomena is that most of the hospitals do have a lot of burden on cancer, and we don't have too many of such specific only for cancer. More so, we have hospitals which do treat cancer patients also. So yes, infrastructure is there. The number of doctors, I think Suresh can probably throw more light on how many people pass out, and do we have the kind of for medical onco or surgical and other things. But yes, there is shortage, not more so in the urban areas, but in the rural areas, the infrastructure development has to happen across the globe, and more so in India because we are a vast country.
Sure. I mean, just to add to the previous 2 data points, and the expected growth is about 13% over the next, it's been 13% over the last 5 years. And the trend is going to continue, obviously, with higher population. Every percentage means more people getting affected by this. Also, 9% of the deaths in India are currently due to cancer, right? Which is significant when you take it as a large, proportion of it. So I think, Dr. Suresh, how has the cancer landscape changed in India in the last 5 years? Also, as the statistics is the advancement in cancer research, which we were just slightly talking about it earlier, is it reducing these deaths? What's your, because you're there in person.
The thing is that in health there is something called as a chronic diseases, there is something called as infectious diseases. Sure. The chronic diseases are those where you cannot cure. Say, for example, diabetes, hypertension, or there is a cardiac diseases. So cancer is also called as a chronic disease. Okay. So you really don't know some of the disease aspects, you know, it is coming because of tobacco use or anything, but a large chunk of the people you don't know why it is coming. Age itself is a risk factor for this chronic disease. Infectious diseases are coming down. If you see in our childhood and all, we would have heard of syphilis, plague. Yeah. We never hear those things because we have taken a control of all those things. Right. So now the only future belongs to chronic diseases like cardiac, cancer. So invariably the disease burden is going to rise. Sure. So we must be prepared to deal with that. That is the trend going on. Sure. As far as the cancer trend in India is concerned, so if you see the previously last decade and all, in the women in India, something called as cervical cancer was the most common cancer. Yes. So cervical cancer has been coming down in India. That's basically because that the use of better hygiene practices. Okay. And now there is a vaccine in the market. So basically cervical cancer is caused by an infection of a virus. Right. So we brought down the infection of the virus and hygienic practices, the cervical cancer is coming down. But whereas in women, the breast cancer is on the rise. Sure. It is the leading cancer in the world today and also in India. Right. So this is because of the lifestyle, as Rakshit sir was talking about, in environmental and all those things, the sedentary lifestyle, the food habits, all have contributed to the risk. The cancer pattern is changing, that the cancer because of lifestyle and all have been coming upfront rather than infection related cancers are there. Sure. Whereas in men it is more often the smoking and tobacco related. Sure. In India, head and neck cancer is the top, followed by lung cancer. So the cancer trend is often change what we do and the environmental changes. So that's how the cancer is changing in India today.
And if you have to explain what are the main types of cancer as of today when you...
So in India, majorly in women, the cancer is the breast cancer is the leading cancer. Nice. So followed by cervical cancer, there is an incidence of ovarian cancer and also the lung cancer in women today. Whereas in men, it's more of a head and neck cancer. There is also a cancer of the lung. There is a prostate cancer. In southern part of India, the stomach cancer is more commonly seen. So that may be because of food habits and also. So in southern part of India, GI cancers, especially stomach cancer, the Bangalore and Chennai registries are reporting more cancer of the stomach. Whereas in northern India, especially Delhi, reports more cancer of gallbladder. So the geographic pattern is basically because of environment and food habits. So these are some of the cancer what we see in our country today.
Sure. And Dr. Rakshit, in your opinion, as running hospitals, like how do you see the trend in different types of cancer? Is it similar? How have you seen the landscape change the last 5 years?
The landscape, like Dr. Suresh said, that landscape is predominantly area-based. So, like in women, breast, which is predominantly seen across. In southern region, like he said, that there are GI, colorectal, lung. These are the type of cancers. So, it's not that the other cancers are not prevalent, but he's seen more of these in the population as it rises. So that I think environment has to change and awareness for people on lifestyle, how to live healthy more so than worry about, okay, cancer is on a rise. How do you avoid? How do you test early? How do you detect and go to Suresh Babu early? If you go to the doctor early, he is in a better position to treat. I think he'll throw more light during the talk on if you're able to identify it in stages, stage 1 itself, he's got better ammunitions for him to treat and prolong. And also, he's got a lot of patients. I think you can ask him a few of them on. People have been cancer-free for a long time as cancer survivors. So there are bright sides of it also. Coming to the hospitals have evolved. There have been a lot of infrastructure growth in most of the states, more so in urban, and tier 2 cities have not been to that large extent, mainly because of paying power of the patient and other things. The government sectors have shown progress, but you need definitely, like Dr. Suresh, more people who can serve in the rural sectors also.
Yeah. I
But-
have a statistic on that. Probably I'll put that in a bit later on oncology specifically. But just expanding on the hospital part, you said there's a lot of changes and there's improvement. But I have one stat which says, despite having 40% fewer cancer cases per capita in India compared to the US, maybe the US sedentary lifestyle is even worse. But India loses 51% more people to cancer than the US. Is that because of the healthcare system difference, or is it people don't test? They don't even know that they have.
Yeah, I studied in the US.
Yeah.
US medical system is not too different from what we have in India. But yes, definitely testing is far more there. People do come to the hospitals more. In India, I think he will be in a better position to throw more light that when people come, they get scared. They go away. They don't come back for treatment.
Yeah.
These things happen, and educating public through like your talk shows and telling them that not to worry, please come forward, get yourself tested, get yourself treated. It is all treatable. Itself will be a plus point in reducing the percentage of deaths.
Sure. And what's your comment on
I
that?
think the issue is that it's the awareness lack. So if you see, and I think previously Dr. Rakshit was referring to stage of presentation. Say, if there are 100 cases, say 50% or more present in stage 1 or stage 2 in US, but it is the reverse pattern in India, where majority of the people come with the advanced stage. So if that is the case, then the cure rate will naturally come down. Again, second thing, the social this thing, say for example, a person have to travel 500 miles to a treatment of cancer. So he is a daily wage worker. How will he be able to travel, cope up with the stress? These are all the things. As Dr. Rakshit was referring to, that they come, they treat, and after that they may not come up to the follow-up at all. That is one aspect. Other thing, late presentation. The fear of society opening up about the cancer to the public, and if there is any problem, opening up to the family members itself and neglecting it as something else, are all the reasons why majority of the Indians come in a later stage than other advanced countries. So that may be the reason why we are seeing more mortality rather than anything else. That is the main reason, I believe.
And people knowing cancer being genetic, it's still a taboo in India,
Yeah.
especially in rural areas. People don't go for cervical screening itself. There have been worldwide programs which happen, but why that fear of, in case something?
Yeah.
And then what will my child,
Think.
what will happen to my child?
Yeah.
How will she get married?
Yeah.
Who will marry her? It's a taboo still.
Yeah.
So, like cardiac was, I think, 30 years back, cardiac was the main cause. Now, cardiac is like any other, like diabetes.
Yes. Yeah. It's more.
People don't, I
It's
think
get-
it needs, it needs a little time and more education through your medias and other things.
So I just want to add a point. So I always tell my patients, see, so if you are detected as a diabetes, or if you are detected to have BP, can anybody cure it? You live with it. But at least in cancer, in stage 1 and stage 2 or stage 3, still you can cure it. So you have a disease which is a curable. When you become diabetic or hypertensive, you don't bother about it. You take it as, fine, I am living with it. But that is the way people should start seeing at cancer. So, yeah.
No, I think this, expanding on that. So the one is cancer detection is very low in India because people don't come forward and get themselves tested. So the reality is actually than what the numbers are. It's probably 2 to 3 times more the actual cases because you wouldn't even recognize it. But in terms of encouraging testing, like as a doctor, what's your opinion? How would someone know if something is imbalanced in their body, or because you have 3 to 4 cancer cases which are more in proportion, and there are few signs which tell that there is possibility of this. So if you take the top 2, 3, and how could they come understand that maybe there is something like this and I need to get myself tested, or is it regular testing they have to do?
I think the cancer screening is basically done for the cancers which are more common in the society. We don't do screening for rare cancers.
Sure.
So especially common cancers like, for example, breast cancer in a female. So after certain, say after 40 years or so, so they are supposed to undergo regular mammography. So that, initially they must seek the doctor yearly once. They must go to the doctor, get the breast examined. That is the way they must do.
Sure.
If a patient is having strong family history of breast cancer, so they have to go a little more early. Say suppose if a breast cancer is detected in a family of 25 years, so they must go at 25, 30 years only to the doctor and get it done. And there is also, if you see YouTube and all, you will have many self-breast examination, these things. People can watch it and learn from it. They can do self-breast examination once in a month.
Right.
So that if they find anything suspicious or anything. Another very important in breast cancer is that breast cancer lumps are painless. People feel that painless lump don't harm. So breast cancer lumps are absolutely painless. Never neglect a painless lump in a breast cancer. That is very, very important you see.
That's almost a sign.
Yeah. So second thing, this is the cervical cancer. You can get once a year or twice a year, go visit a gynecologist, get a cervical or pap smear. And the people who are using tobacco, chewing tobacco regularly, to get their oral examination regularly. So for in males, majorly it is the lung cancer. We advise only for heavy smokers to get an X-ray, routine checkup at least once a year to detect. For head and neck cancer, oral examination again can be done. One more cancer more common in male is the prostate cancer. You can get your prostate examined and do a blood test. So these are the simple tests. So these constitute for majority of 50 to 60% cancer in the country. So these are some things which they have to do to detect cancer early.
Sure.
I will just add another thing. These tests are not expensive. They can be easily done. All people need is a will, just to go once. An ordinary biochemistry test will predominantly explain majority of these things. Doctor will get a red flag immediately as soon as he sees a blood report.
When you say it's not expensive, how much does it average cost at this?
It depends. I think a PSMA is less than about $2, less than $2. It's like not really too expensive.
150.
Yeah, an X-ray really doesn't cost money.
Yeah.
Like Suresh Babu said.
Yeah, it's a very cheap. All the tests are very cheap.
They
Can
are
be
not
done
expensive.
Right.
So people should not worry. They are all regular checkups. A pap smear test will cost 450 Indian rupees. So it's really, really not expensive. So, and anyway, they go to the hospital for an overall check. Just get it done.
Right. So I think so the barrier is not the cost, and probably there must be some government incentive schemes which will also help with.
Government has a screening program in place.
Yeah.
Especially for village and all, there are healthcare workers who visit the house every time. The only thing is that public must cooperate with them. So they might come. So if they bring it to notice of any health worker or Anganwadi worker, they will definitely take the person to a doctor and show that. Sure. So I think that willingness is very important in the society to show them. So all tests can be done freely in the governments. So they will do very freely. So it should not be a problem.
So that should not be a roadblock. I think we talked a little bit on oncology earlier, and the ratio, as we see again on some data points, is there's only one oncologist for every 10 lakh Indians. So we are almost a gem sitting here in terms of the ratio. While in the US or UK there are about 100 oncologists for the same 10 lakh Indians. What is the reason why this number is small as a ratio?
I think basically the ratio number small is because of our population. We do have a very good oncologist. The other thing is that some oncologists, when they clear the degree, they settle either in US or UK. If you see the statistics of UK foreign, 10 to 25% of oncologists from India. Yeah. So the roadblock is not the number of oncologists. The roadblock I see is the oncologist willing to serve in the rural area. That is the roadblock. See, in Bangalore has more than 200 medical oncologists.
Yeah.
So how much medical oncologists we have in other cities is the question. So having the oncologist to work in a district sector or has to be supervised. Otherwise, the Bangalore only keeps on growing, but other parts will have the deficiency. So whoever oncologist, our infrastructure and medical thing is much better than what the other countries do have. Only thing, we must give the proper setup and things to serve them in the non-urban areas where. So then I think this problem can be solved.
I think that's a question for Dr. Rakshit, running hospital yourself. Like, how could you see more people coming in? How could be more people encouraged to join this?
It is a catch-22 situation. Let's face the devil. Let's not evade the devil. It is tough. Building an infrastructure is really not the problem, but the willingness of other infrastructures to grow along. So like the medical oncologists who are serving in Bangalore, they also have a family, they have children who would like to study in a good school. Infrastructure development of schools, transport, education, healthcare in other places, all is a combined effort.
Yeah.
If I just build a hospital, I can't move. Even if I pay extremely well to a medical oncologist, medical surgeon, or a general cardiac person itself, because their family would like to stay in a city. Your other infrastructures also have to develop.
Sure.
Their commute time should reduce. Everybody at the end of the day, when they want to retire, would like to go to a village and settle down. That's all our ambition and hope. But we do have this situation. And this situation is there across the world. So it is difficult, but it's improved. The A category cities like Bangalore and urban cities, the B categories are like the major towns like Mysore and Hubli, Belgaum, all those. The infrastructure has developed. It's not that it's not developed, it is developing. We should give it a little more time for it to...
So the more the tier 2, tier 3 cities start developing, building infrastructure.
And the willingness of the doctors to sell in their own places should come, and it will come over a period of time once the infrastructure develops.
I think to look back 10 years ago, many of the districts in Karnataka never had a medical oncologist at all.
Okay.
So now Belgaum has, Hubli has, Dharwad has, Shivamogga has, even Kolar has.
Okay.
So I think, as Dr. Rakshit was telling, over the time it will happen. So what was 10 years ago is not today. I think 10 years ahead it will be a much better situation in the country than what it is today.
Sure. So I think that's a fair point.
And I will also like to highlight a particular thing, like because you compared the European and the US doctors to the Indian doctors, I think Dr. Suresh Babu and all, the number of patients he sees per day,
It's very high.
those guys see it in a month. I don't know whether they will see it in a month. So the quantum of patients our doctors see in India because of the population is still large.
So I think they make up for that.
It's stressful also.
It's very stressful. I think that I was coming to that for both of you, but related towards you, because as a field, I mean, to any doctor, it's always a slightly negative environment because people come only with problems and troubles, and cancer again is more as a terminology itself, it is very harsh. So how do you deal with it on a day-to-day basis? Because mentally, for your own self, your own mental beat. So how do you handle it?
I think the cancer treatment has been not like as it used to be. It is a more satisfying and all those things. So why I tell you, the public have that fear about the cancer. I don't blame, but media and all would have contributed to see. If you want to kill a hero in your movie or heroine, the only disease you find is cancer. You never kill a hero with diabetes, isn't it? Yes. But that is the fear created. But as I was telling you before, cancer in early stage is a curable disease. You must create that positive aspects. So we may be hearing the bad stories. There are much more good stories too, and it's very satisfying. Especially some of the pediatric people who have cured of cancer have become doctors. So there is a very good story. I think one of the things is that there are also change in the treatment pattern. Now, previously what oncology used to do, we were looking at only curing the disease. Now we are seeing at a disease as that it's not only curing, we are also looking at the quality of life. Second thing is that we have had a drugs of only chemotherapy before. Now we have moved up in an era of targeted therapy. Chemotherapy used to have a lot of side effects. Targeted therapy don't have side effects. Like for example, if a diabetes is there, you will not be cured of it, but you will take tablets and live with it. So in cancer also, in advanced disease, there are drugs. You take the drugs and you live with it. So previously, even the lung cancers and all would have, in a very advanced stage, would have not survived more than 6 months or so. Now, lung cancer are surviving years. So that is the positive things. Without any much stress, only targeted therapy with the tablets, people are living for years together. So that is a positive aspect of things. So when you see a day-to-day a patient who has been doing well, good, that will definitely compensate for the thing. So that's how I think the oncology is about the passion. People who train and all those things would have seen that from the basic training. So hopefully everybody will cope up with that stress. And very important in any cancer patient is the support of the family. Suppose if a patient is diagnosed with a cancer, as a doctor I may spend 30 minutes, an hour with them, but other 24 hours will be sent by the family. How much support they give, it will keep the person very happy. We have a patient of stage 4 cancer surviving 5-6 years or more without any side effects. So it's a very positive thing in recent what it was there before.
And there is a lot of thing. It's very challenging. And when human beings challenges thrown to you, you tend to react better. And there are like new targeted therapies. There are new markers. Each is personalized. It cannot be the same for everyone. So understanding, analyzing, being compassionate, trying to treat him, he becomes very attached to each one of us, the patient. Seeing him go as a normal person gives us more energy. And research field, cancer is a research field and it's evolving every single day. So we get a lot of energy. So it isn't bad as such. It is depressing when you lose a patient. It isn't that everything is rosy. When we lose a patient, it is very harmful and it is traumatizing for doctors as such. But seeing the people who have survived gives us the energy to take it forward.
I think that's what drives you every day. When you see the success part, when people actually get cured, and which is the
hope.
The hope, yes, the hope. And I think it's a very valid point both of you mentioned, because for the patient, it's not obviously the family who's living 24 hours with them, but also they look for the doctor's words, the confidence in the doctors.
Doctor is treated as God.
Absolutely.
And when doctors says that, boss, you're going to become all right, he's got the hope of living. And that should never be lost. And being compassionate should be learned from the Indian doctors, the kind of thing. There is stressful situation because of the load they go through, but otherwise they're very compassionate.
I think culturally also in India we are more compassionate and understanding, right? So which helps with the patients and the treatment. I'm sure now obviously India has got a lot of foreign patients coming here and getting treated. So that's a big validation for us on our healthcare systems. Right. So I think moving to India's again position in the healthcare system, maybe this is directed to you, Dr. Rakshit. Are there any policies, developments which is happening, anything which is changing, which is exciting for you? What you're looking forward to?
India is definitely evolving. It is evolved over the past, I think, 15 years. It's evolving further, and the changes are leaps and bounds. So it's like for commoners, if you the number of millionaires, if you had seen before, were quite few, handful. So now you have a sea change in last 15 years because the economy is evolved. Similarly, medical thing is also evolved across, and especially in India. You're having brighter, you have more patient inflow, revenue generation for the economy as such in terms of healthcare has evolved. It's a large sector. Consolidation is happening. So now you see more so few major brands are holding on to the infrastructure in private. it evolves and there's a lot of fund flow into the system. There have been government policies which have encouraged this. That's why you're seeing this sea change. Public itself have seen a large willingness to go to a private hospital, get themselves treated. They would like the comfort. So you have seen the economic boom, especially in India, over the past 5 years, 10 years has evolved.
Sure. And I think this is question for both again, but directing to you, Dr. Suresh. Obviously, you have one side, the doctors who are going through this journey every day, seeing what's happening. And there's a research going on one side to see how to improve this situation and make better treatments. How does the collaboration work? Like, how do you as a doctor, and maybe next question for you, Dr.
I think the research in India has been very fast. Suppose if you see in a year, say, there are, 10 path-breaking drugs coming to world today. Among the 10, 5 to 6 belong to oncology. So such a big research is going on in India or around the world. One of the positive things is that if you have 100 lung cancers, not all 100 are same. Each patient is a different.
Right.
So that's where the targeted therapy comes. Now in lung, minimum more than 20 targeted markers available in the world today. So we have the facilities to do that in the country. So if you do that facility, and if that particular target, if you give the drug, then the side effects are also minimal, and the response and results are extremely good. So that's where we are looking into. So to give an example how even in America or anywhere else, if you want to get a scan, you have to wait for months. That's not the scenario in our India today. If you want a scan, it can be done next hour. So our health system has really evolved and come this thing. So we are moving to an era of targeted therapy, immunotherapy, and much more thing in the market today. So in that way, I think we are much better ahead, and research and the hospitals are collaborating. There are a lot of clinical trials going on in the country, and we having so much of cases, so we are doing a lot of clinical trials. I think every year new drugs are coming, so that the cancer survival is definitely going up.
Sure. And then that's how you collaborate with
Yes.
research, and then
Yes.
so that you the new treatments are getting done.
Yeah.
Now, I would like to just clarify for your audience that the moment you hear clinical trials is not that we're making patients as guinea pigs.
Yeah.
What Dr. Suresh Babu and we jointly together, or any doctors or research team do, is we don't have to infuse any particular thing. So now the technology has gone to such an extent that if sir is seeing a lung case and you have a tumor, we extract the tumor lung through an FNAC or any of those surgical procedures. Those cells are grown in the lab. His targeted therapy drugs are treated on the cell outside the human being.
Okay.
You will know exactly which drug is going to work, what is the efficacies, what will happen, how is he targeting, much before than the patients. Why I mentioned this is the moment you use clinical trials word, people should not assume that we are guinea pigs.
Yeah.
Clinical trials are the way forward. People don't get it onto them. Yeah. So it's not on an animal, not on a human being, it's on lab. And those cells react, they will know exactly what it is. Seeing a patient, seeing a cell, how it reacts, gives medical oncologists a better weapon to treat.
Understood. So, I think obviously we have talked about testing, we talked about different types of cancer, how people go through it mentally, psychologically. There's one other aspect, because to plan ahead, right? And I think especially young people now don't really understand the cost of medical treatment. It is very high. That means the right insurance covers to be done much ahead, to be planned. Obviously, if you're covered under scheme, then you're covered. But otherwise, as a normal, let's say a professional who is working, all the life savings, what he's done when he's the age of 45, 50, something like this, God forbid, happens, they lose all their life savings. So what should someone at this age, let's say even as young as 25 to 30, how can they plan their health cover? And question to both of you.
I think the health cover is very important. Health cover is two aspects. So, see, for patients who are affordable, higher middle class or higher class, can do a private insurance for the health cover do, they must make sure that when health cover is done, whether chemotherapy, targeted therapy and immunotherapy are covered in the health insurances. Whereas the people who are living below poverty line, government themselves have the health cover to cover them. So for the patients who can afford, they are definitely have to health cover. So remember that the health cover will cater for almost 80% of any patient's need. There could be still a 20% which can be, but that's fair. It's not only in our country, even in US, some of the expensive drugs, because they have health cover, instead of taking every day, people have started taking alternate day and all those things. But as a youngster and all, you must have an health insurance to that. So make sure that it covers oncology. In that, it covers all the aspects of treatment of oncology. As far as the below poverty poor, government themselves have made a health cover. Almost everybody in this country are covered by some or the other form of health cover as far as the treatment is concerned. So how much they do, it's up to them. But affordable, they do up to 10 lakh or more. But it's better to have a health cover so that everybody is safe. Yeah.
Absolutely.
It is tough to for everybody, but most of the people tell I'm very young, so I don't need insurance.
Yeah.
So that's a wrong thing. So you should have insurance for various, forget cancer or any hospitalization or any of the treatment. It's better you be covered. There are two aspects to it. If you are affluent and you can afford without an health insurance, to a person who has to undergo an insurance. So the government sectors have predominantly taken, but the negative of that is all the drugs will not be available for Dr. Suresh Babu to administer onto like a targeted therapy. I don't know whether the insurance will cover it and is it affordable and can it be done to everything. Rather than thinking negative, at least there is an health cover, there is an health insurance. So that will take care of it. But for youngsters, it's better that you enroll yourself early. The moment you enroll yourself early, so your benefits keep increasing over a period of time. What happens in the US where we study is the employers predominantly have, based on your stature in the organization structure, the higher in the pyramid you go, it is covering. But the mid-level and the lower, globally, in Medicare or Medicover, which are both private and government together as a combination which works in the US, I have still a gap which they have to fill. Like Suresh Babu said that in India, the treatment is instant. In US or in the Europe, if you are a paying patient, you can go in. But if you are on an insurance, you take time. But cancer, when we are talking about, is a disease which is long duration. So it's predominantly okay. But like he rightly said that you have to read in between the lines.
Yeah.
And when you're making the first policy, be certain that you go through all those details, sit with him before. Just don't, somebody comes and force you to take an health insurance. Okay, I've got myself 5 crore covered. Yeah. What does that 5 crore cover? So that's very critical for youngsters.
Detail has to be gone through in detail, maybe taken advice with even like a family doctor. Or
now you have the AI assist. So you just have to tell the AI that I'm taking this, does it cover?
Right.
It'll give you all the data. So you can sit with your provider, insurance provider, before you sign up, or you can always change that.
Understood. So obviously one is to prepare yourself, get your health insurance much earlier in life, and then that covers reduce the risk. But I also want to ask because you have obviously for people below poverty line, the government is covering, then insurance will cover for people who have insurance. But is there anyone who goes through something like this? Because I think one is we want to talk about financially. Is there any NGOs, any sort of bodies which can help financially to certain type of people, and also like the mental health and support? Because one is you have a family, strong family is good, but otherwise, how do these people get the support and mental health during these phases?
I think the financial support, if you see, there are a lot of social platform who raise the funds for the cancer patients. You might have seen that they raise the funds. Other thing is there are also people who are voluntarily donate. Say for example, some people donate some of their amount and say I want it to be utilized only for the cancer drugs. There are people who donate only that we want to donate only for the bone marrow transplantation. Especially the social support is more there for the pediatric cancers because it's an emotional aspect. Most of the child care, there will be definitely have donors available rather than an adult and older patient. So there are a lot of social platforms and all those things which are there to be help and support and try to rise forward. Definitely there are there. So there are also some groups which are like, for a patient who has been cured. So they have made their own social group to give a psychological support. There are many groups, like in Mumbai there is a group called Sanjeevani, so which is founded. If you call them, they have their own group of people who talk to you, try to give you comfort to you and all those things. Every hospitals do carry a social workers. They look after their train tickets, their bus fares, and if anything required to the family, minimal things they will try to take care. So there are a lot of volunteer groups which are available. Only thing is that in our country, being a lot of illiteracy rate and all those things, they have no access to that. So we must improve on that. But there are a lot of groups if people are willing to. So there are a lot of groups who are ready to help, trying to provide help for this thing. So there are a lot of voluntary groups which are coming. So I think over the time this is going to help, and it's going to improve also.
There are a lot of groups which have come up and sprung across the world. So you're talking about two aspects. One is long-term care, which you're talking about the people of the aged. Long-term care has to develop in India more so because of our population. It is tough. It is a lot of time consuming, lot of revenue which has to be pumped in, as well as chronic cases where the patient is on a ventilator for a really, really long time. So, but in US and Europe is more evolved. You have a lot of communities as sects who have donated land, building, infrastructure, funding, which is both by government and private together. Like my school and MIT, Harvard and MIT together have adopted a old age home which handles about 100 people. Like that, colleges, infrastructure, people, like he said, should come forward and give it back to society. And you can definitely create it. It's not a real rocket science. Somebody has to be passionate about it. If somebody has suffered in their house through cancer or a cardiac or age old or Alzheimer's for basic things. So the societies as such, either a patient or a patient support system, they can come forward and create. And they have to develop, they have to donate. They have to sit more so, not money and forget about it. All the youngsters should come forward and spend some time for these kind of causes where they time. When they give their time, it's more than money. Money will flow. Corporates, CSR funds are coming in. All you have to do is channelize it properly.
Right. That's a nice summary. Any final thoughts, Dr. Suresh?
I think the only thing is that I want to tell, don't fear the word of cancer. That's the positive thing we must try to give out of these things. So I always tell my patients, the day when we born, we acquire some knowledge, we know we are going to die one day. We don't live with that fear. So we live our life. We don't think that we are going to die someday, why should I lie? So cancer is a disease which is definitely curable if you come in an early stage. Now even if you are at advanced stage, we are moving into era of targeted therapy and immunotherapy, where people never used to live for 6 months, now started living for years. To give you an example, one of the first targeted therapy drug was called imatinib, which was detected for CML, which is a type of blood cancer. Before that, the people hardly lived 6 months or 1 year. Now after 2000, there are people who have lived for 24 years on only one tablet. So there is a treatment available, so people are going to live with it. So have that positive attitude attitude, go to the doctor early, you will be free of cancer, and even the quality of life will be definitely like as you were before the cancer. So that is a positive way of looking at cancer. So every year there is a lot of research going on in cancer. What is today will not be there for tomorrow.
Yes.
So we are going to get more better days what it was before. That's the positive thing I want to tell you.
Thank you. Dr. Rakshit?
I would like to just say that go to the doctor early, go to the right doctor early. There is no bad drug because you don't have a good patient. Each one is personalized. Go to the right doctor, have a second opinion, get yourself treated, don't fear. Everything is treatable. People have been living with it. In the past, people are going to live more better in the future. Only thing is, enjoy your life religiously, but not to the optimum that you run out of fuel.
Yeah.
Enjoy your life and plan it properly.
Sure. Yeah, makes sense. I think
And good to and Citizen Talk Show, and I hope more talk shows bring in this kind of awareness to the people, so people can learn more. And
Yeah. No, I mean, yeah, exactly. So I think the whole idea was the talk show was to get viewers to understand from the beginning what cancer is, how it could be detected early, how it can be avoided altogether. And as we said, like in India, the cancer detection is in the later stages, but we can detect it probably earlier and it's more easier to treat. We also talked about how support can be given, how we can plan ahead with insurance and financially. So these are things which we can really forget in our life when we are doing our day-to-day things. But again, I think on top of that, to live a better lifestyle, eat right, not a sedentary lifestyle, healthy lifestyle. We're living in cities which is already hard in terms of pollution, in terms of noise. So these are things which we don't have control over, but at least things which we can control also can help us reduce. It's been
exercise regularly.
Exactly, yes. It's been fantastic talking to both of you. Dr. Suresh, thank you so much again for making time and coming in, talking about all the topics, and that's very insightful for our viewers. Dr. Rakshit, thank you again.
Thank you so
much for coming and giving us your insights. And I hope you viewers enjoyed this episode. Do like, subscribe, and comment if you have any questions. We will be in touch. We'll probably also ask any more questions in the comments. I'll be able to bring it up to you and reply back. So thank you again.
Thank you
so much. Thank you so much.
Thank you.